All right, and now we're going to introduce our second fellowship team, and this is a partnership between Barrier-Free Living and Stony Brook University. Did you guys, and so go ahead and unmute yourself and introduce your project if you could.
Hi, I'm Cynthia Amodeo. I'm the Chief Program Officer at Barrier-Free Living, and this is a partnership with Michelle Ballan, a professor over at Stony Brook University. And our project is titled Advancing Practice-Relevant Research for Survivors of Intimate Partner Violence with Disabilities. Next slide, please. So a quick summary of our project is that we have a research team from Stony Brook, and we have some practitioners at Barrier-Free Living Freedom House, which is our domestic violence crisis shelter for people with disabilities. We have 4 people on that team working with us, and they are going through the past histories, our client files, and collecting data to inform the work that we're doing. So we're going from 2012 to 2018, and it's a very tedious project, but the staff are very involved and excited to be doing this, because with the goal is that we understand better the population that we're serving so we can ask better intake and assessment questions moving forward. As we know, people with disabilities experience a higher rate of violence than people without disabilities. The Freedom House is the first domestic violence shelter that's to be completely accessible in the United States. So the people we're seeing have unique issues that they're coming in with, so we want to make sure that we're tailoring our intake and assessment to meet their needs. That's where we're currently at, is actually doing the data collection. But Michelle and her team have reviewed all of our former intake and assessments, and we have actually implemented our computerized system as of April 1st to move forward. So Michelle and her team have also looked at our computerized system. So for future research, we can make sure that we're gathering information that's pertinent to research. So right now, the most important thing that we're doing is the data collection. And when that's done, which we hope to be in a couple of months, Michelle and her team will clean, code, and analyze. And we'll go back to all the intake and assessments, and we'll go back to our computerized database system and make the revisions as we need. And the overall goal, of course, at the end of this project, we hope to better understand the ways that diversity and disability-specific factors impact the experience of abuse for people with disabilities.